Have you ever awakened with a sense of disquiet, as if something within your body is amiss, yet you cannot articulate it? Many seniors dismiss these peculiar morning sensations, attributing them to mere aging or a poor night's rest. However, what if these subtle indicators are, in fact, your body's plea for assistance? Each year, thousands of older adults retire for the night in good health, only to awaken to the onset of a significant medical crisis. The reality is that our bodies do not deteriorate abruptly. They issue warnings, quietly and persistently. The sooner you heed those warnings, the greater your opportunity to maintain strength, independence, and safety. Today, we will discuss 3 significant warning signs that must not be overlooked. If you encounter any of these, particularly on multiple occasions, you should contact your physician immediately. Do not delay until conditions deteriorate or until someone else observes the issue. This is your body, and it is conveying a crucial message. So, take a deep breath, and let us commence. Advancing in age does not equate to relinquishing authority over your health. Rather, the more we comprehend, our bodies communicate with us, and the greater our awareness, the better we can safeguard our future. This is why today's video is crucial. We will examine 3 specific signs you may observe upon waking. These are not mere trivial discomforts. They may indicate significant underlying issues. Perhaps you experienced confusion one morning, felt tightness in your chest, or noticed sudden swelling in your feet after a restful night. Many individuals overlook these subtle signals, but for those over 65, they warrant attention. These may serve as early indicators of stroke, cardiac issues, or organ failure. By the conclusion of this video, you will be equipped with the knowledge of what to observe and, more crucially, the appropriate actions to take, as prompt intervention can preserve lives and potentially safeguard yours or a loved one's. If you prioritize remaining informed and enhancing your well-being annually, ensure you follow our channel and activate the notification bell. A sudden onset of confusion or difficulty in speech may occur. You may awaken one morning feeling unwell, despite the sun illuminating your window. Your preferred mug awaits in the kitchen, yet your thoughts seem ensnared behind an opaque barrier. You attempt to articulate your thoughts, but the words elude you. You inquire of your spouse regarding the day, but falter, asking, "When's? Wait, what was I saying again?" This experience transcends mere forgetfulness. It is not simply a moment of seniority, but rather something more disjointed and disconcerting. If it occurs abruptly, particularly upon awakening, it may signify a more grave issue than it initially seems. This precisely transpired with Harold Patterson, a 76-year-old retired mailman from Ohio. Harold had been a reliable individual for decades, the type of man who never missed a day of work, never forgot an anniversary, and never lost his train of thought mid-sentence. However, one morning, everything changed. Harold awoke feeling unusually lethargic, as if he had not slept at all. Upon reaching for his glasses, he noticed a peculiar heaviness in his hand. When his wife, Janet, inquired whether he preferred oatmeal or toast, Harold attempted to respond, but his words emerged as garbled, resembling the act of chewing his speech. Janet suspected he was. Although initially jesting, Harold appeared perplexed, his eyes blinking rapidly as if attempting to comprehend his own speech. They both dismissed it at first, attributing it to fatigue or possibly hypoglycemia. However, 3 days later, Harold collapsed in their living room and was transported to the hospital, where doctors diagnosed him with a complete ischemic stroke resulting from a blood clot obstructing blood flow to a portion of his brain. Upon reviewing his scans and timeline, they uncovered a chilling revelation. Harold had suffered a transient ischemic attack, TIA, 3 days prior. Prior to the stroke on that hazy morning, the disorientation and difficulty in speech were not merely due to fatigue. It was a transient ischemic attack, TIA, and the opportunity for early intervention was overlooked. So, what precisely is a TIA, and why is it imperative to regard it with gravity? A TIA, commonly referred to as a mini-stroke, represents a temporary obstruction of cerebral blood flow. Unlike a full stroke, a TIA does not result in lasting damage, with symptoms typically resolving within minutes to hours. However, it is crucial to note that a TIA frequently serves as a precursor to a significant stroke, according to medical experts. The American Stroke Association indicates that nearly one-third of individuals who experience a transient ischemic attack, TI, will subsequently suffer a full stroke within a year, with many occurring within just a few days. The symptoms may be subtle, including sudden confusion, difficulty forming sentences, slurred speech, challenges in recalling words, or a sensation of mental fog upon waking. These manifestations are frequently misconstrued as sleepiness, fatigue, or dehydration. However, for individuals over 65, these seemingly minor issues may signify that the brain is indicating a problem with blood flow, and that time is of the essence. The brain requires a continuous, unimpeded influx of oxygen and nutrients via the bloodstream, particularly during the night. Individuals with conditions such as hypertension, atrial fibrillation, or arterial occlusion may experience restricted blood flow. Consequently, early morning hours represent a critical period for strokes, as blood pressure typically elevates upon awakening and the body transitions from a state of rest to activity. For seniors with potentially compromised circulation, this shift may provoke transient neurological events. Upon waking, if your speech is incoherent, you experience cognitive sluggishness, or your memory is impaired, these symptoms may resolve within an hour. However, this does not imply safety, but rather a stroke of luck. Therefore, if you encounter such an episode, do not disregard it. Should you awaken feeling disoriented, having difficulty articulating thoughts, or sensing mental irregularities, promptly contact your physician or proceed to the emergency room. Even if symptoms subside, your healthcare providers can conduct imaging assessments, such as MRIs or CT scans, to investigate further. Indicators of TIA or diminished cerebral activity necessitate early detection, affording the opportunity to implement preventive measures such as initiating anticoagulants, modifying antihypertensive medications, or addressing underlying health issues prior to the occurrence of a complete stroke. In addition to consulting your physician, there are minor practices you can adopt immediately to mitigate your risk. Firstly, ensure adequate hydration throughout the day, particularly before bedtime, as dehydration can thicken the blood and elevate stroke risk overnight. Secondly, maintain a consistent sleep regimen, adhering to regular waking and sleeping times. Maintaining consistent daily routines aids in the regulation of blood pressure and cognitive function. Additionally, it is imperative to monitor blood pressure regularly. If you lack a home monitor, consider acquiring one, as many pharmacies provide complimentary blood pressure assessments. Lastly, trust your instincts. Your lifelong experience has attuned you to your body's signals. If something feels amiss, even without a clear explanation, it is warranted to seek medical evaluation. Harold and Janet now possess a heightened awareness. Harold has made progress in his recovery, though not entirely, as his speech has returned. His previously unwavering confidence now wavers slightly when he answers the phone or recounts a story at church. However, they express gratitude for their newfound understanding of the significance of one morning's warning, hoping that others will heed their narrative and take action more promptly than they did. The peril of this sign lies in its propensity to be easily overlooked. A poor night's sleep, a forgotten medication, or mere morning grogginess are commonplace. Nevertheless, confusion or difficulty in speaking that arises suddenly, particularly after rest, should never be disregarded. Your brain is attempting to communicate. Do not delay in heeding its messages. These indicators frequently manifest subtly, akin to a whisper in the early morning. However, what starts as a whisper can escalate into a tempest. This leads us to the subsequent sign, often overlooked, as it may not always present as pain, yet it could serve as a covert warning that your heart is at risk. Let us examine the next two signs, chest tightness or pressure. Envision awakening before dawn, with the house in silence and the birds yet to sing. The morning light has yet to penetrate the curtains. You sit up, stretch languidly, and abruptly become aware of a sensation, not acute pain, nor anything overtly alarming, but rather a pressure, an unusual tightness in your chest, akin to someone gently yet firmly pressing down on you. You inhale, wishing for it to dissipate. Perhaps it is heartburn, perhaps anxiety, or, conceivably, something far more perilous. This was the experience of Gloria Thompson, an 81-year-old from Charleston, South Carolina. Gloria had always epitomized resilience. She was a retired piano teacher, self-sufficient. Gloria, astute and diligent in tending to her rose garden each morning, awoke one day last spring at 5:30 a.m. with an unusual tightness in her chest. It was neither sharp nor crushing, merely constrictive. She sat on the edge of her bed, waiting for 10 minutes. Although it did not cause pain, it felt amiss. Reluctant to create a disturbance, she dressed, brewed coffee, and assumed it would subside. 3 hours later, her daughter visited and immediately discerned something was amiss. Gloria's complexion appeared pallid, and she was perspiring. Upon their arrival at the hospital, medical professionals informed her that she had experienced a silent heart attack, likely commencing hours prior, possibly even during the night. Gloria had been ambulating for hours while her heart was in distress. What, then, constitutes a silent heart attack, and why is it prevalent and perilous for the elderly? A silent heart attack, or silent myocardial infarction, occurs when blood flow to a portion of the heart is obstructed, akin to a conventional heart attack. However, in contrast to the dramatic chest-clutching portrayals often depicted on television, these heart attacks can transpire without overt symptoms. Minimal or absent overt symptoms may manifest, with pain potentially being dull or imperceptible. Frequently, the sole indicators are ambiguous sensations of pressure, dyspnea, nausea, fatigue, or diaphoresis. Seniors, particularly those over 65, are predisposed to these silent episodes due to alterations in pain perception associated with aging, pre-existing medical conditions, and neuropathy resulting from prolonged diabetes or other chronic ailments. According to the American Heart Association, over 45% of heart attacks are classified as silent, with older adults being the most affected demographic. The risk of completely overlooking these signs stems from their tendency to be easily dismissed. Most individuals do not correlate mild chest tightness or morning pressure with a life-threatening condition. They often attribute it to acid reflux, prolonged lying down, or an awkward sleeping position. Furthermore, since it is not accompanied by pain, it is perceived as something that can be postponed. However, the heart does not always signal distress vocally. At times, it merely whispers. When such subtle indications arise, every moment is crucial, as the longer a blockage remains unaddressed, the greater the damage inflicted. The heart muscle sustains permanent damage once compromised. If you awaken with unusual pressure or tightness in your chest, particularly if it is new, persistent, or feels abnormal, the initial step is straightforward yet vital. Do not dismiss it. Sit upright, monitor your breathing, and observe any accompanying symptoms. Are you perspiring or experiencing dizziness? Does the pressure dissipate rapidly, or does it persist? Even if the sensation is mild, and you believe you are likely fine, you should promptly contact your physician or proceed to the nearest medical facility. If you reside alone, contact a neighbor or family member to accompany you if your symptoms exacerbate or are accompanied by nausea, jaw or arm discomfort, or difficulty breathing. Call 911 immediately. It is always prudent to err on the side of caution rather than remain silent and risk irreversible heart damage or worse. Regarding prevention, how can you mitigate the likelihood of awakening one morning with this silent warning? First, prioritize heart health daily. If you smoke, cease immediately. If you have hypertension, diabetes, or hyperlipidemia, manage these conditions effectively. Adhere to those conditions meticulously with your physician's guidance. Maintain an active lifestyle through daily walking, stretching, or light gardening. Even 30 minutes of movement daily contributes to vascular health and enhances circulation. Consume a heart-healthy diet abundant in vegetables, fruits, whole grains, and beneficial fats such as olive oil and avocados. Refrain from heavy dinners and late-night snacking, as these can exacerbate reflux and disrupt sleep, thereby placing additional strain on your heart overnight. Lastly, heed your body's signals. No one understands your baseline better than you. Something seems amiss, and it likely is. Gloria now possesses a diminutive reminder, a heart-shaped charm on her keychain inscribed with the phrase, "Listen early, act fast." This serves as a reminder for her and her daughters that health is not solely indicated by loud alarms. Often, it involves recognizing subtle signs. Following her silent heart attack, Gloria transformed her lifestyle by incorporating morning meditation, reducing her salt intake, and consulting her cardiologist every 3 months. Most significantly, she discusses her experience, as she initially believed she was merely being. While she asserts that toughness is paramount, it is crucial to recognize that toughness does not equate to intelligence. Many seniors have been conditioned to endure pain, dismiss discomfort, or avoid being perceived as burdensome. However, disregarding a warning sign does not eliminate it. Rather, it allows it to escalate. Therefore, if you awaken with unusual pressure in your chest, distinct from pain, do not trivialize it. Take it seriously. Trust your instincts and acknowledge that your life warrants attention. Although heart attacks may manifest silently, the resultant damage often conveys a significant message. If the subtle pressure you feel is your heart's plea for assistance, the most detrimental action is to feign ignorance. Now, let us proceed to the third indicator, a caution that frequently conceals itself in plain view, manifesting not in your mind or chest, but rather in something as unassuming as your feet. Swollen feet or ankles may appear overnight. It begins like any other morning. You swing your legs over the bed's edge, prepared to commence the day, and upon glancing down, you notice your feet appear puffy. The skin surrounding your ankles is taut, and the bones. What you typically observe is now obscured by an unusual soft swelling. You blink, rub your eyes, and question whether it is merely a figment of your imagination. You did not twist anything, bump your leg, or experience any discomfort overnight. So what transpired? Why are your feet swollen? This was the precise inquiry Mary Linwood posed to herself one tranquil morning in early spring. Mary was 81, a retired librarian from upstate New York, residing alone in the home her husband had constructed decades prior, surrounded by a plethora of novels and antiquated books. Mary was astute, organized, and in good health. Despite her age, she walked every afternoon, maintained a low salt intake, and diligently monitored her blood pressure each morning. However, for 3 consecutive days, she awoke to discover her feet and ankles swollen, neither painful nor red, merely unusually puffy. On the first morning, she attributed it to a salty dinner. On the second, she reasoned it was due to prolonged sitting while watching television. By the third morning, her slippers barely fit, and her legs felt heavy, as if she were dragging waterlogged towels. Nevertheless, she hesitated to contact anyone, as she did not experience pain. Mary experienced a fever and hesitated to inconvenience others. However, when she disclosed her condition to her daughter during a video call, her daughter urged an immediate visit to the doctor. Tests indicated that Mary's heart was not pumping blood as effectively as before, revealing early-stage congestive heart failure, with swelling being the initial conspicuous symptom. The phenomenon of swelling in the feet and ankles, particularly overnight, is medically termed peripheral edema, a symptom of significant concern for seniors. Accumulation of fluid in the tissues, frequently resulting from inadequate circulation or fluid retention during prolonged periods of recumbency, particularly at night, leads to the redistribution of fluid that is pooled in the body throughout the day. If cardiac function is compromised or renal filtration is suboptimal, this fluid lacks a proper outlet and consequently settles in the lower extremities, specifically the feet and ankles, due to gravitational forces. The outcome is that upon awakening, the feet may appear swollen and constricted. While some degree of foot swelling can be benign, such as after extended sitting or standing in elevated temperatures, sudden onset should be approached with caution. Persistent morning edema may indicate underlying conditions, most frequently heart failure, renal disease, or hepatic dysfunction in the elderly. These ailments can progress insidiously. The heart may fail to circulate blood effectively, resulting in venous congestion and fluid leakage into adjacent tissues. Impaired renal function may permit excessive sodium and water retention, culminating in fluid overload. Additionally, certain pharmacological agents, particularly those prescribed for hypertension or diabetes, may induce edema as an adverse effect.